All right, today we're going to jump into a really fascinating piece from Barron's. It's all about a massive shift happening in healthcare, and it zooms in on one company that, despite a pretty big stumble recently, might just be in the perfect spot to ride a powerful new wave. So yeah, let's dive right in. Just think about that for a second. For millions of people out there with chronic conditions, the choice to get treatment anywhere but a hospital, well, that's a no-brainer. And that one simple preference is kicking off what could be a huge investment opportunity. So what we're talking about here is this fundamental move, a really big one, away from the old school hospital setting and into our homes or other kinds of alternate site medical care. And believe me, this isn't some small ripple. It's more like a tidal wave that's completely reshaping how medical treatment gets delivered. I mean, look at the two sides. On one hand, you've got the traditional hospital, and on the other, you've got the convenience, the comfort, and more, the cost effectiveness of getting that same care right in your own living room. And for the health systems themselves, this frees up badly needed hospital beds and helps bring down the overall cost of care. It's really a win-win. And you can really see the momentum building here. The market for infusion therapy, that's basically delivering medication with an IV but outside of a hospital, is projected to grow at an average of 8.6% every single year through 2030. That is a powerful long-term trend. So you might be asking, what's really driving all this? Well, it pretty much boils down to three key things. First, patients just prefer the comfort of their own home. It's huge. Second, a lot of new medications are actually being designed specifically for at-home infusion. And third, the health systems themselves are all in on this model to help slash their costs. And that brings us to the company that Barron's puts right in the spotlight, Option Care Health. They are the clear market leader in this fast-growing space. So who are they? Well, Option Care Health is the biggest provider of these infusion therapies in the entire country. They're the ones who administer complex medications, either right there in a patient's home or at one of their, get this, more than 170 clinics across the U.S. Now let's get into the numbers. We're talking about a company with a market value of around $4.5 billion, and they're projecting sales to hit over $6 billion by 2026. But here's the real twist. The stock is actually down over 13% in the last year. And that dip, that's the real key to this whole story. And just so you get a sense of their sheer scale, this is not a small-time operation. The company has a team of more than 5,000 clinicians out there on the ground, making them a really critical piece of our country's home care infrastructure. So, why the stock dip we just mentioned? Well, it definitely hasn't been all smooth sailing for them. The company recently hit a pretty significant snag that, frankly, really spooked investors. And the whole issue centers on this blockbuster drug called Stelara. It's used to treat inflammatory conditions like Crohn's disease, and a major change related to this one drug sent some serious shockwaves through the company's stock price. So here's what went down. The company that makes the drug cut the price spread, which is basically the profit margin that pharmacies, like Option Care, gets. This change, which is tied to the Inflation Reduction Act, is expected to slice somewhere between $60 and $70 million from Option Care's gross profit in 2025. Yeah, not small change. But the company's response points to something really crucial, just how diversified their revenue is. Yeah, this Stelara thing was tied to legislation, but as you can see, only about 12% of their total revenue comes directly from government programs. That provides a pretty significant cushion against any future political shifts. Okay, so with that big challenge now out in the open and, as some analysts argue, already baked into the stock price, let's flip the coin. Let's look at the bull case and see how this builds a strong argument for a potential rebound. And here's the absolute key point from an analyst over at Citizens JMP Securities. He says that because all the bad news about Stelara is now public knowledge, a lot of the uncertainty is gone. The portfolio now looks, in his words, de-risked. Basically, the market has already absorbed the hit, and now it can move on. And in spite of all that headline risk, the actual business underneath looks really strong. Their recent revenue climbed a very healthy 15% year over year. And it looks like that strength is going to continue. Management is showing a ton of confidence by raising their full-year guidance to around 13% growth. They're also putting their money where their mouth is. They're backing up that confidence with a brand new $500 million share buyback program. And that's a classic sign that the leadership team thinks their own stock is a bargain. So what does all this add up to? Well, that very same analyst believes the stock has a potential upside of 34%. He's arguing the real story here isn't a temporary headwind, it's the company's fundamental strength. And beyond just the numbers, there are other tailwinds pushing them forward. The company's making smart moves, like acquiring Intramed Plus to expand their footprint in the Southeast. And maybe most importantly, there's actual bipartisan support in Congress to expand patient access to home infusion. That's a big deal.
Okay, let's bring this all home. When you put all the pieces from the Barron's analysis together, what's the big picture here? What's the main takeaway?
The core idea is basically this. You have a market leader in an industry that is definitely growing. It took a major, very public hit, which may have just creating a really attractive entry point for investors. And now, it seems like it's ready to get back to business and capitalize on that massive, long-term shift toward at-home healthcare. So that leaves us with one final thought. We started this off by asking if the future of healthcare was outside the hospital. Well, this analysis suggests that future is probably closer than we think, and it might just be getting delivered right to your front door.